I'm going to tell you about the study that we are presenting on Friday the 13th at the AHA live breaking session. It's the results of a study called the TIPS-3 study, TIPS standing for the International Polypill Study. A polypill is a product that contains more than one component to control more than one risk factor for disease, in this case, cardiovascular disease. The product that we test, the polypill that we are testing, contains three medications to reduce blood pressure. It contains a statin to control control cholesterol. And in a separate arm, we gave aspirin as a separate product. We are presenting the study in two parts. My part is actually going to be the polypill versus placebo, whereas my colleague, Professor Salim, Yusuf will talk about aspirin alone and aspirin plus polypill. So now I'm going to tell you only about the polypill. The way we did this study is we wanted to see if the polypill given to people who don't have heart disease yet but are at risk of getting it can be prevented by taking one single pill of this combined product once a day. So we took people aged 50 for men and 55 for women who didn't have heart disease but were at risk of getting it and randomized them to receive either the active polypill or a matching placebo to be taken once a day. As I told you, they were also randomized to receive either aspirin or aspirin's placebo, which I'm not going to talk about because that's the subject of another talk. Patients came, there were 5,700 in all patients recruited from 14 countries around the world, but the majority of patients were recruited from India and the Philippines, but we had a significant number also from Canada, from Colombia and South America, and from a number of other Asian countries like Indonesia, Malaysia, and Tunisia. The study had a mean follow-up period of 4.7 years, and then ended in 2017, the recruitment, and the follow-up finished as of 30th of June this year. The findings we had in our study was that the polypill reduced cardiovascular disease events by 21% compared to placebo in those who took it. And this seems to have been done by the fact that it reduced blood pressure as well as reduced the low-density lipoprotein cholesterol. The systolic blood pressure over a period of 5 years was reduced by almost 6 millimeters, while the LDL cholesterol was reduced by about 18 milligrams per deciliter over the same period. So, our conclusion from this study is that the polypill given alone as a very convenient and relatively low-cost product can reduce the risk of cardiovascular events by over 20% in populations. There are a few caveats. The first caveat was we had some issues with drug supply because of major logistic issues and COVID at the end of the trial. So more patients than we would have liked actually came off the drug. Not because of side effects, but because of these logistical issues. If we take that into account, then the benefits of the polypill actually go up to around 27 to 28%. As my colleague will present in the next paper, if we combine a polypill with a low dose of aspirin, 75 milligrams, the benefits actually go up to about 38 to 39%. So on the whole, this combination of a polypill with aspirin, which can actually be combined in a single pill, if given to people who have a risk of heart disease, can significantly lower the risk of heart disease in large populations. As I mentioned, it's low cost. It's given in a fixed dose. You don't need to periodically measure the cholesterols and adjust the dose. And we have done another study in which we actually had non-physician healthcare workers giving these medicines out to people in rural communities in Malaysia and found that it does good there. So we feel that this drug has great potential in community prevention of cardiovascular disease, which today is one of the greatest killers of people all around the world, not only in developed countries, but also in developing countries.